we will talk about tinnitus. Tinnitus is noise in the ears or ringing in the ears. It is tightly tied to aging. As we age, our auditory system is degraded over time, and it can be compensated by this noise. So age-related hearing loss and age-related tinnitus is very common. And let's talk about treatment. First and most important treatment is hearing aids. Hearing aids are devices. They look like headphones and they amplify outside sounds and outside environment sounds, and it masking the tinnitus. So for many people who has tinnitus because of age-related hearing loss, for them first line treatment usually is hearing aid. Of course, here quality of hearing aid is important. Another treatment method is sound therapy. And what means sound therapy? First is that you can play a low level background music and it can mask tinnitus. It's very common practice for many people. They find it's themselves that it's practical and it's more comfortable if you hear music as a background, or you can make some white noise machines also, and it masks this tinnitus. That's why for people it's very practical and comfortable. Another treatment method is cognitive behavioral therapy. And what means cognitive behavioral therapy in this case? It means that you're learning to live with tinnitus. You're learning and you adapt that tinnitus is with you, and it's not disaster, and living this tinnitus is okay. You're learning this. So maybe you have disruptive thoughts that my tinnitus means that I'm going to crazy and such thinkings, and you will replace such thinking with healthy ideas. For example, that yes, I have tinnitus and it's okay, I can live with it. That's healthy idea. But if you think that everything is over because you have tinnitus, it's not healthy, of course. And cognitive behavioral therapy helps you to accept and adapt your tinnitus. It's important part because cognitive behavioral therapy will help you to improve your quality of life. And most important part, what tinnitus is doing is it decreases your quality of life. So for you, it's very important to increase quality of your life. And cognitive behavioral therapy helps you. Another treatment method is acoustic neural stimulation, ANS. Acoustic neural stimulation, what it means? It looks like MP3 player, and it has headphones, and this headphones gives you variety, wide range of wide frequency of sounds, and it sensitizes your auditory system, every part of auditory system, and it can reduce tinnitus. It's difficult to imagine at first glance, but if you think about it, like orchestra where these musicians are playing out of order, and you hear some buzzing sounds from some musicians which should not be exist. And this ANS therapy, or acoustic neural stimulation, looks like conductor which gives every player, every musician its part of their part of music, and they starting to play with each other. They starting to play more compatible with each other and no such noises. So it's also common practice. It is called acoustic neural stimulation. Of course, there is limited data because it's a relatively new method and it's not very effective in every cases, of course, but it's still important. Also, you can help your tinnitus with lifestyle changes. For example, avoiding loud noises, avoid caffeine, avoid nicotine is important. Especially nicotine is important because it can restrict your blood vessels and blood supply of your air decreases and tinnitus can be increased. And avoid loud noises is must also. And exact relationship between caffeine and tinnitus is not detected, and there is no important study which says that caffeine can increase tinnitus, but there is some studies, that's why we still can keep it in mind. And about supplements, what are the best supplements for tinnitus? Ginkgo biloba is well known for it because ginkgo biloba improves blood supply and blood circulation in our auditory system, and it can improve tinnitus. And zinc and magnesium also important, but their role also not strong and not well evidenced. So it was treating methods of first age-related hearing loss and tinnitus. It was hearing aids, sound therapy, cognitive behavioral therapy, acoustic nerve therapy, lifestyle changes, and supplements. Now let's discuss second most common cause of tinnitus is noise-induced tinnitus. And what means noise-induced tinnitus? If person exposures loud noise constantly, for example, if he is construction worker or musician or in army, maybe such persons have constant exposure to loud noise, and it decreases their hearing also, and it damages hearing cells. It is called hair cells, and this damage is irreversible usually. That's why such people losing their hearing. So what is treatment here? First and important is you should avoid loud noise. If you still keep exposure loud noise, your tinnitus and your hearing loss will progress. So you should stop first. Second, there is same treatment methods like hearing aids, sound therapy, cognitive behavioral therapy, acoustic neural stimulation, lifestyle changes, and supplements. You can do the same in case of noise-induced tinnitus. There is no different treatment, and sometimes there is needed of antidepressants because person can have depression because of tinnitus, because it really decreases quality of life. So now let's discuss third most important cause of tinnitus is ototoxic medications. Very common medications like aspirin, ibuprofen, and antibiotics like gentamicin, tobramycin, and cancer medications and diuretics can be ototoxic. They can damage hair cells, and this damage can be irreversible also. Sometimes in 50% of cases this damage can be reversible, but sometimes it's irreversible. So you should be careful. Even with aspirin and ibuprofen, they are very common medications, but they can be ototoxic. It's very important. That's why you should not intake them if is not indicated strongly. You should avoid these over medication and over treatment of different conditions, you should try to avoid such medications, even such simple medications like aspirin or ibuprofen. It's very important. What can we do at this case? You should stop intaking that if you feel tinnitus during intaking medication, you should stop it first, and you should switch it with analog medication, which is safe for your ears and which is safe for your tinnitus. You should ask your doctor to switch medications. It's important, and because if you keep intaking this medication, tinnitus can become severe and permanent. Now we have fourth disease. Fourth most common cause of tinnitus is Meniere's disease. Meniere's disease also is important because it affects not only our hearing and not only our tinnitus and noise in the ears, but it causes vertigo. It causes balance problems. What is Meniere's disease? We have three parts of the ear: outer part of ear, middle part, and inner part of ear. And Meniere's disease affects this inner part of the ear. Meniere's disease causes fluid accumulation in the cochlea and vestibule. So we have fluid accumulation here, and this fluid accumulation causes symptoms. It causes disruption of balance, and it causes noise in the ears. It is Meniere's disease. We don't know why it happens. We have no clear risk factors. We have no clear evidence why it happens. It happens sporadically. Usually, we can prevent it. It can have some genetic factors, but it's not very clear why and when it happens. So this disease is important because it can affect almost everyone, especially after 40. What can we do during Meniere's disease? Restrict salt intake is important because it decreases fluid accumulation. Diuretics are important, like hydrochlorothiazide or acetazolamide is important. Sometimes steroid injections into air is important also. It can help reduce this swollen and inflammation, and surgical intervention sometimes it requires, such as endolimb sac decompression or or vestibular nerve section or labyrinthectomy. And supplements are same, like ginkgo biloba, magnesium, and vitamin D and zinc also are used. That's Meniere's disease. So in Meniere's disease, salt intake is important. Diuretics is important. Diuretics are more effective in case of vertigo attacks, and sometimes steroid injections also important. Prognosis depends, and prognosis varies. Sometimes Meniere's disease can have remission, sometimes can progress over time, sometimes stop at some point. So prognosis is different and varies, and it depends on individual factors. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.